Good morning, everyone. Welcome to Change MedX 2019. I'm Dr. Brandi Sinkfield. I'm a practicing anesthesiologist in the Bay Area. I'm the former digital health fellow here at MedX, and I'm currently a director of clinical initiatives and clinical quality at my hospital. I want to start with telling you a story about a patient I took care of last week. This is a gentleman who came in for an irrigation and debridement of a shoulder. That's a fancy term for saying we needed to wash out his shoulder. Okay, he had an infection there. I looked at his chart, I checked the medications, I got my equipment ready. I've got an excellent surgeon, an excellent operating room team. The nurses are communicating well. I'm gonna nail this case, okay? So I walk to the pre-procedure room. This is the area where our patients are seen prior to surgery. And the first thing I see are some bright neon pink shoes. And I follow them all the way up. And I lock eyes with a woman who's got huge sandbags underneath her eyes. And she's kind of slumped over, but she's looking at me. And I can tell she's exhausted. Next to her is the patient. The patient locks eyes with me, and I realize I'm locking eyes with a grown man that is near tears. I also realize that I've taken care of this patient before. I took care of Todd when he first had his rotator cuff shoulder repair, and he's here again for an infection. I instantly go into compassion and empathy. Sir, I'm so sorry you had to come back for this infection. And he kind of looks at me and he says, Doc, I'm not worried about this surgery. I've been here 6 times for surgery, but I'm frustrated. I'm frustrated because this was not how I planned my day. I came in to the doctor's office for a follow-up. My wife is supposed to have sinus surgery tomorrow. What I did not plan for is for someone to tell me that I would now be on antibiotics for 2 to 3 months, that we're actually here to remove all the hardware from the shoulder, so my right arm, my dominant arm, will no longer be mobile. I cannot be the breadwinner for my family for the next 3 months, and I can't take care of my wife nor my children as she cares for me for the next 3 months. So I pause for a second. I'm scratching my head. I'm thinking, well, Todd's changed all his plans for us. How in healthcare have we changed our plans for him? Where are the priorities? How can we align ourselves with Todd so that we can take the best care of Todd and give him the best outcome? My ask for you this weekend, is to use the human experience. Simple. Use your senses. Use your nose, use your taste, and ask yourself, if you have a new innovation, you have a new idea, what does that smell like? What does it taste like? If you have a new transformation, how is that going to adapt into your daily habits and rituals? We need the data field for the human experience. We need that a part of our healthcare setting and our culture. We need to ask the questions about the human experience. I look forward to hearing your ideas and what you uncover as we spend the next weekend learning about all of these new ideas and opportunities. I hope that you share them with others, and I look forward to meeting with you as you share them with me. Welcome to Change MedX 2019. Thank you for your time.